The South African Medical Association trade union says it's now taking its fight to get unemployed doctors placed directly to the finance minister. This follows a series of protests that have taken place in various provinces to highlight the plight of unemployed doctors and also prove that there is a solution to delay services in public health facilities. The organization's General Secretary is Dr. Cedric Sihlangu, who joins us now via our video link. Doc, thank you very much indeed for your time. We've heard anecdotally just how bad the situation is around the unemployment of doctors. Speak to us about this change in tact to take your cries to the finance ministry.
Good morning, Ayanda, and thank you for having us. Well, you would be aware that this problem is recurring, and in fact, we've been having these marches now for about 4 years, where in every year, beginning of the year, we see a plethora of doctors who find themselves languishing out of employment. And of course, invariably, some of them end up going overseas, which is really regrettable. And we've been taking this plight to the health minister. By and large, we've had a couple of marches before. And all we discover is that, of course, it's an issue of finance, and therefore the minister is going to go and speak to his colleague in National Treasury. What we have decided to do as a COSATU block of public health sector unions is really to take the plight directly to the doorsteps of the Minister of Finance. Of course, this is not only affecting doctors, so that will be your nurses, your emergency healthcare services professionals, your OTs, your physios, and your allied. So as a group of unions within the COSATU block, affiliates of COSATU, we are going to be taking this march on the 31st of January to the finance minister, of course, to raise this plight of unemployed healthcare professionals, but also to deal with the issue of austerity measures that are having a direct impact now on critical posts which are not funded, and yet we know the dire need in the communities that we serve. And as a result, it really is the finance minister that needs to account and to find a solution on this problem.
Sure. The sense we're getting, of course, is that, well, let me ask the question in this way. What the health department has always said is that they simply don't have the funds. But the sense I'm getting from you is that even if that were to be the case, there can be a reallocation to make sure at the very least that the funds are made available.
Perfectly put. The issue, and you know, Ayanda, that it's all about priorities and prioritization. So we've seen in the past where government is able to bail out entities such as Eskom, for example, bail out your SAA, your airports company, South Africa. Now, it means that when the need arises, government is able to move around funds and actually allocate where they're needed. But we find it quite strange and peculiar that when the funds are needed where it matters most, for the poor, the marginalized, and those who are without means, government suddenly is very slow to act to prioritize healthcare, prioritize this appointment of these healthcare workers so that they can serve the population. But we can tell you the reason why we see that happening is because the decision makers, the ministers, all have PAMED. So they all have this sophisticated medical aid, which they rely on. So they go to the private healthcare system, which is very well furnished in terms of employees and staff. So they get treated by specialists, but the bulk of the population will not have access to your generalist doctors. And that's where we find the problem to be really unacceptable.
Yeah, you're absolutely right. Depending on your socioeconomic background, you could be insulated from this issue. And that's why I think my next question is quite important. Help us take stock of the impact of what's taking place. I mean, there was what we now know to be a fake notice being sent around that doctors won't be available in certain hospitals in the Eastern Cape. In fact, we'll unpack that in just a moment with the health department. But it does, I suppose, still raise all manner of questions around how the issues you are raising are having an impact on people on the ground in places like the Eastern Cape who don't have as much access to healthcare services as they would have.
Just on that allegedly fake notice, I mean, that's the nub of the issue, is that fake as it may allegedly be, the reality is there are institutions that do not have doctors. There are facilities, whether it's your CHCs, whether it's your level 1 hospitals, that may go on a night without a doctor because there's so few of them. And those that do have a doctor, you'll find a doctor who's been working day and night shift for about 14 days without rest. Now, you can't expect that doctor to be functioning optimally. And in fact, even if they are placed on the roster and their name appears there, they are no longer providing the acceptable standard of care. And hence you find this consistent increasing levels of litigation. Your medical malpractice litigations are constantly on the rise because you've got a worn-out staff. So you can argue that there, in fact, aren't any doctors in these hospitals that allegedly have doctors on the roll.
Sure. Really troubling indeed. I'm loath to ask the next question, but perhaps I should nonetheless. I mean, do you have any kind of timelines that you are hoping that the finance department will be able to respond to? And I'm asking this because, as you've already mentioned, we have been here before where protests are held, and it didn't seem that any of that has moved the dial, so to speak.
Yeah, look, we're going to be having the march on the 31st. Of course, we'll give reasonable timelines for the finance minister to apply its mind with his colleagues in the Treasury. We anticipate that within 2 weeks we should have some directive of what should be happening. But of course we are eyeing the SONA that's coming up and the budget speech that will be coming up, so that in there we expect proper budgeting for the coming financial year, but equally such that this problem does not recur come 2025-26 budget year. So what we are saying is we want the immediate solutions now, but we want something more definitive going forward, so that in the coming years, we don't see this repetition happening.
All right, Dr. Sihlangu, thanks very much indeed for speaking to us. We appreciate the time.